Hello, everyone. Dr. Nikhil Verma here with another episode of Things I Didn't Learn in Med School. Today, I want to talk about an experience that I had this past week. Um, as many of you know, I'm pretty interested in the regenerative medicine and their capabilities of healing and helping improve musculoskeletal conditions, including arthritis, tendonitis, tendinopathy, joint pain in other senses, ligament damage, um, potentially some muscle healing properties as well. And I'm such a big proponent of this that I wanted to get my own shoulder looked at. I've kind of had nagging shoulder issues since, we'll say, high school. Playing football, got hit a few times, and over the years, improper lifting techniques. I also have kind of overused it in different various sports. And then in about 2017, 2018, I actually fell on that shoulder jumping up for playing flag football, jumping up, and I landed right on top of my right shoulder. And it led to some pretty severe pain and a little bit of a chromium clavicular disconnection, a small separation that kind of healed on its own. Um, but over the years, it's kind of just been getting worse, and I feel like it hasn't getting better, especially in the past few years. So I've been going to physical therapy, doing the stretches and all that stuff, and it's just kind of still lingering. So I wanted to see what I could do to improve the health of that area. So not only am I one to talk about these kind of therapies as potentially beneficial, but also I'm interested in just how I would treat myself or treat a loved one if they had any similar issues. Um, Now, obviously, I couldn't. I'm not able to do these kind of procedures on myself. I wanted to go to a company. Well, it's a franchise, but they have an office here in Columbus. So I went to them and I kind of was inquiring, like, what does all of this look like? And almost to my horror, it was not what I expected. We'll leave it at that. Now, I don't want to name the company's name. I also don't want to say that I know everything about this topic. I want to say that the experience that I got was a little eye opening, and it can be disheartening for a practitioner that does offer these kind of therapies for patients to see what kind of things are out there, and what they're telling patients, and how it can be very misconstrued as truth, but it's not really. Uh, and I figured the best way to do this is kind of walk through my experience and give my honest feedback on each part of the experience and kind of go from there. I'm not going to say what the name of the company is or who they are. But if you have any questions about it, message me privately and we can discuss. The first and foremost thing, um, they have ads all over the United States, but specifically in Columbus, where they have a couple of their offices. Um, I have seen their ads on Instagram, Facebook. They're on the radio all the time, using some prominent ex-athletes as their talking points. So that gets someone excited, obviously. And the athletes have partnered with these companies, and they explain that they've gone through these treatments and gotten great results. So I picked up the phone. I gave them a call. The phone call questions were pretty good. It's just typical. Um, typical patient outreach. I don't know what else to call it, but essentially, these are people that are trained to be very friendly to you, very nice, and kind of get your foot in the door. They ask you all the right questions. Any higher level question I had about anything medical related, they didn't know how to answer, but they were able to say, like, what are you dealing with? How long have you been dealing with it? And that kind of stuff. And then you get a little questionnaire of an online questionnaire. Takes about, we'll say, 7 to 10 minutes at most. And you fill out your past medical history, past physical history, past surgical history, anything else that might be important, any supplements you take, any medications you take. All of these have very important to consider when you're doing these procedures. Um, After that, I had to wait a few weeks. Granted, my schedule has been a little busy. I'm guessing their schedule is busy as well. But when I got there, it was a very nice office, very clean. It didn't have overcrowdedness. It was homey. It didn't feel like you were in a doctor's office kind of situation. The front desk was super friendly, super nice, super helpful, engaging. That's exactly what you want to see. I think that's a really positive thing. Um, to have the face of your franchise or your face of your company, having someone that is nice and able to carry a conversation and ask some valid questions and make sure you're comfortable and all that kind of stuff, especially if you're going through a procedure or a situation that you've not been through before. And that's exactly how they were making me feel. Again, I think they're a little bit busier this day than most days. You're If you go through one of these experiences, apparently you're supposed to meet with a patient care coordinator. This person is someone that doesn't have any medical training, but they will take you back to the room and kind of do a quick questionnaire and see what you're there for, see what kind of things that you are dealing with, make you understand the structure of how things are played out. They don't go too much into the um, procedure itself, or at least I don't think they do, because I never actually met with the patient care coordinator. But for me, what happened was, because the patient care coordinator was with another patient, the nurse practitioner actually came directly to my room. And I think she did a lot of the stuff that the patient care coordinator would have done as far as screening questions are concerned. She talks really fast, and it makes me think, and I'm actually going to do a video about this a little bit later in a few weeks, but it's one of those things where there are types of people that talk about a topic and they know the superficiality behind it. They know the basics behind it. They understand it to maybe beyond a weekend seminar. But there are people that talk about it, but they don't really know the topic. And that's the feeling that I got. She was using a lot of fancy words, a lot of terminology that's outdated, ideas that are outdated. She gave essentially the wrong history of how orthobiologics or regenerative medicine came to be a treatment option for us nowadays. She wasn't too familiar with some of the bigger names and the pioneers in the field, not only in the 50s and 60s, but 70s and 80s and even more recently. And she was also explaining pain inappropriately. Um, it sounded like a biological sales pitch, which is fine if you know what you're expecting. But a sales pitch can go wrong in a very easy way if you are having a conversation with somebody that might know the topic, even into the smallest amount of detail. A lot of it was not just, it just wasn't like lining up, and it's hard for me to explain without going too much into what she said, because I'm trying to see if others have the same experience and can understand. But I don't want to just verbatim say what she was saying. Partially, I don't remember all of it because that wasn't the main point, but just that's the feeling that I got, and I think that's the most important message I'm trying to get across about that interview process that we have. Another sales thing that she did, which I feel like this was a very trained thing to do, is, once she got done interviewing me, she put her papers down on the table, which, we appreciate when our doctors do those kind of things and give us direct contact. And she's like, first off, I want to congratulate you because, not everyone's a candidate for this. And based on your history, based on your physical findings, based on this and that, I think you're a great candidate. So that's a huge step right there. So obviously she's trying to hook me and make me feel better about myself about making this decision. Again, a sales tactic. I'm not sitting here to try to say that all sales tactics are wrong or gimmicky, but it's one of those things that people can do to get you locked into something like that. And then this was the time she moved on to the physical exam portion. Now, I actually complained of a couple of joints that were bothering me, mainly my shoulder and my back. My back doesn't hurt me too much, but I do have some inflammation from time to time, so I wanted her to address it. But, we'll just stick with the shoulder. The shoulder exam that was done for me was, as a physical medicine rehabilitation doctor, as a musculoskeletal health physician, someone that appreciates sports medicine, it was a very, very disheartening exam. What she did was allowed me to do some passive range of motions where I moved my arm up and down on the side, forward flexion in front of me, and that was it. And then she grabbed my arm and did the same thing in the same planes. And then she did a little bit of external rotation when you bring your arm up, a little internal rotation when you bring the arm down. She would push against my arm, and that was it. No special tests, which our orthopedic colleagues and our physical medicine rehabilitation and our sports medicine colleagues know how important these physical exam maneuvers are, with the specific amount of sensitivity and specificity for a diagnosis of certain tendons or structures that might be damaged. There was no specific rotator cuff testing. There was no biceps tendon testing. There was no labral testing. There was no shoulder dynamic instability testing. There's no neurological testing. This could very easily be maybe coming from the neck as a cervical radiculopathy for some patients. It could be related to maybe a nerve injury. So none of this was tested. No reflexes, no sensation or anything like that. So that's a major red flag in my system. If your physician is trying to do any procedure for you and is not going through these basic physical exam maneuvers plus some special tests, then there's something majorly wrong with that picture. The other thing is, they asked me if I had any imaging. I said, no, it's been a few years. I haven't really had any imaging, any recent imaging. If I do, there's my records. And I don't have any imaging. I've never really cared to go get it, kind of because I know what's going on. And I've been doing my physical therapy exercises as prescribed by a physical therapist and what I read online to kind of manage. And it's been manageable. We'll leave it at that. But yeah, so I had no x-rays and no MRI. So at this point, the best of the best, will say, that are able to spend the time will bust out the ultrasound machine and say, let's see if we can see any torn tendons or any ligament damage. Let's check the rotator cuff. Let's check the acromioclavicular joint. At the bare minimum, checking some of these things to see if we can pinpoint a point of inflammation or of damage. So that made me question. And as we sat down after she did her physical exam, she said, I think you're a great candidate. Here are the things that we would do. And she was explaining to me their protocol, which is a series of injections, 5 injections specifically. And then she allowed me to talk and ask my questions. So I asked a lot of questions, me knowing what I know, et cetera, et cetera. So, I asked, what kind of cell counts are you getting? She said it doesn't really matter because the cells know where to go. I asked her what kits they're using, and she said a system and a kit that has some good data behind it, one that I find suitable and respectable, but maybe not the best choice. I asked who obtains the cells from our body, either from the blood or from the bone marrow or what have you. She said the nurse practitioners do. It's not extremely difficult to do these procedures to get those, but that's not something that I would feel comfortable having a nurse practitioner that only went to a few courses. I'd really want it to be someone that's done it thousands and thousands of times over many years. And it seems like there's no formal training in musculoskeletal conditions outside of whatever this company's national meeting was. So this is obviously a concern of mine as well, especially if you're injecting somebody into certain spots. I asked them, how do you know you're in the right area? And she said, well, first off, the body knows what's damaged, so the cells will go there. To my knowledge, this has never really been proven outside of petri dishes in the human body. The damaged cells don't give that loud signal to allow the cells to migrate there. I could be wrong on that. The next thing was, she said, so I asked, do you use any x-ray guidance or ultrasound guidance? And she's like, no, we don't need to do that. And I said, why do you feel that way? And she's like, well, I've been doing this for 5 years. I've had a lot of experience with injections. And that made me pause right there, because including my training, including how long I've been doing this out in the field, and how long I've been understanding trying to study and understand the musculoskeletal system. We have 4 years of residency and about 2 years of fellowship, and I've been out in practice for 3 years. So, I've been out doing this for about 8 years now, just about. And that, if you include my medical school training, years 3 and 4, where I was getting more and more interested and more in these joint injections and stuff. I still feel like I am just on my uprise of my skills. There are practitioners out there, injectors or ultrasound experts out there, that are light years ahead of me. And I am going to the courses, I'm watching them online, I'm still studying, I'm still understanding, I'm still learning, I'm picking up the books that the experts have written, I'm talking with my colleagues. For someone to say that they have 5 years experience, and that's a long time, made me very, very concerned, because she felt so confident in her answer with that. And I'm sitting here saying that, confidence is fine. I appreciate that. I think I'm a good injector myself, but I'm still learning. And to say I've been doing this a long time and just hanging my laurels on that would really, really not be a true statement, because I think there's always so much more we can learn. There's almost always so much more we can discuss. And the biggest thing is everyone's anatomy is different. So we have tons of variations from person to person, let alone from joint to joint. So it was a very tough thing for me to hear when I said that, because they're doing these blind injections. People are spending a significant amount of money, which I'll get to in a little bit, to this company to allow this to have a blind injection. And that is very disheartening. And I think that's one of the reasons why we might be getting some poor outcomes in our regenerative medicine studies, is we have practitioners out there that are just doing it, and they're not counting the cells. They're not really understanding what they're injecting, where they're injecting. They're not properly diagnosing the generator of pain. It could be a lot more things, but these are just a handful of ideas that makes me worried. So we'll go back to the idea that they have 5 injections. You'll hear other places saying we need to do series of 3 injections, series of X injections, or what. From my experience and who I discuss with, is if we're treating the right area, you can probably get away with 1 injection. If we know what we're treating based off of physical exam, MRIs, ultrasounds, dynamic physical exam findings, static physical examining findings, all those things will give us a very, very good idea on what we're treating. And then we have to formulate what we're treating with how much cell concentration, what kind of cells are we using? Are we doing bone marrow with the mesenchymal stromal cells, mesenchymal stem cells, or are we doing a platelet-rich plasma, PRP protocol, or just doing a plasma protocol? All these things matter for each and every single spot. It's not just a one-size-fits-all situation for everybody. Just recently, there was a lawsuit in Texas about how non-clinically trained salespeople were going out and giving seminars, paying for people's dinners, explaining what regenerative medicine is, and to sign up right there to go to the physician's office, which was actually a physician that had a nurse practitioner working for them, and they would do these injections. again, without any of these, first off, the salespeople had no formal medical training, so that was a major red flag. But this is feels like a very similar situation of, we're just trying to get people in the door and sell this package that may or may not have any evidence behind it, or skewing the data for their favor and putting anyone who might be in a vulnerable situation, who's especially in a lot of pain, otherwise they wouldn't have gone there, who's looking for other options, who don't want surgery. And at this point, they're like, this sounds like the best thing ever. Sign me up. If you don't have any knowledge. So I think one of the purposes of this video is for people to have that knowledge. I don't want people to go out and spend lots and lots of money. They were overcharging way too much. Conversations this week have been running around peptides and exosomes. As far as exosomes are concerned, there are no FDA approved conditions for the exosomes. You're not allowed to use them as anything, treatment-wise. So anyone that's doing that and they're charging thousands and thousands of dollars, like some people are, I would highly recommend staying away from those individuals. Now, do they have a potential in the future? Yes. Do they have some growth factors and opportunity? Yes. I'm not saying that. I'm just saying that they aren't approved for any medical reason, not even approved at all. So it's a conversation for another day of the legality between regenerative medicine, exosomes, and all that kind of stuff. After my interview with everything and everything was done, the nurse practitioner, had left and said, I will send in the patient care coordinator in a few minutes and get you scheduled if this is what you'd like to do. Patient care coordinator still was caught up, maybe with another patient, maybe dealing with something else. I'm not quite sure, but she came back in and she showed me the price list. And for one joint, it cost $8,500. If anyone is charging you this for one single joint for, they're justifying it for 8 different types of injections, without doing any visual guidance, without having expertise in the field, without going to the courses, I would highly recommend turn and run the other way. And it's not just the $8,500 for the one joint. If you were to add another joint on or another area, it'd be an additional $4,000. So, often we have arthritis in multiple knees, or both knees or multiple joints. We have shoulder arthritis, knee arthritis, ankle arthritis. So to charge per joint like that is just ridiculous. And again, like I said, they break it down for their 5 joints. But even if you're paying somebody, a few $1,000s for a basic PRP injection, you might be getting ripped off. I'm just saying might be. I'm not saying you are. Depending on their skill levels, depending on their expertise, how long they've been doing it, are they doing it the right way? Are they staying up with the evidence? That's the tough part about regenerative medicine, because people don't stay up to the evidence and they just want to make a quick buck. For stem cells, yeah, I can see someone maybe charging around $3,000, $5,000, maybe $8,000. But usually there's a protocol involved. And again, it comes with that expertise and visual guidance. And the thing that people don't understand and don't see is the prehab portion of how much time I spend with my patients before one of these procedures, explaining to them, these are the exercises I need you to start doing today. I need you to change your diet starting tomorrow. I need you to read this pamphlet. I have a handout that's a regenerative medicine pamphlet for all my patients so they can understand the procedure from when they come to the office and when they leave, and what to expect that night and what to expect the next day, all that kind of stuff. What medications to avoid, what supplements to avoid prior to the procedure. All these things come to that same these small details that other places may not give. There's also a post-visit follow-up where, you're making sure that the patient feels comfortable, and quite often after 3 weeks they're like, I don't feel any better at all, and I have to re-explain how regenerative medicine works and what the next process and the next few steps are. And I also want to make sure they're capable of getting back into a home exercise therapy program or doing physical therapy again. So I walk through them what that may look like to get them back to an active lifestyle. This was something that this facility that I went to, they didn't explain any of that. They didn't care what you ate that day. They didn't care how you felt. They didn't care what you were doing the days leading up to it. They didn't really care about the days after. And one thing that really upset me personally was she's like, after you get your injections, if you really promise and give me a wink to do your physical therapy or home exercises, you know, I really encourage that. And there was no like importance on it. These are the important parts. The prehab, the pre-injection, and the post-injection are probably way more important than that injection itself. And that's how we're going to get better. And that's how we're going to get ourselves better. And I think, and this is actually at the end of the interview, she asked me, how do you know all this information? What seminars did you go to? I kind of explained what I do and, where I practice and everything. And I told her, like, there's some things that I just do differently. And I said one of the things is I don't believe in multiple injections unless we need to. And there's definitely some cases we need to, or we'd like to explore that. And then the other thing was the pre-hab, what exercises, stretches, and stuff are you doing right now? And then the post-hab, how can we get you back to a functional state? So that was a long-winded way of me saying of my experience of regenerative medicine. I've only experienced what I've learned from my mentors in the past, and I guess you never really know what else is out there until you go out and check for yourself. And I wasn't doing this to bring them down or to hate on their brand or whatever, despite my feelings for them one way or another. I wanted to see if there's something that could help me. And after that consultation, I realized it's probably not something that I would want to invest that kind of money for myself. And I highly encourage you out there, if you have a loved one or if you know someone that is going to companies like this and they might feel like, this is too salesy or something doesn't feel right, feel free to reach out to me. I'm happy to tell you who I feel are the good players in the area. Now, that's just an opinion. I don't know who is or isn't at the end of the day, but at least I'll give you my honest feedback, and hopefully that'll help you make a decision that's best for you without breaking the bank. So everyone, thanks again for watching. I hope you found this useful. I have taken a break, obviously, for the past few months, been busy. I have some new ideas that are coming up for the next few months. Some of it being more like this, where it's patient focused, but can also help the educational side for the physicians and healthcare workers out there. Some will still be about healthcare policy, but a lot of it will be directed towards patient education and how they can help themselves, exercises, stretches, some general health tips, whatever you want to say. So I'm looking forward to taking that journey. You'll see in my next video what my new project is kind of coming about. The main thing is I've realized some things in myself, and I wanted to change those things. And I think I've been taking the past few months to really reflect upon that. At the end of 2022, I did this video called Why I Was Wrong About Everything in 2022. And I kind of gave my take. So I actually, and I don't know if it's timing or what, I've kind of done a deep reflection over the past few weeks, months, and it's coming back to that same thing of, why I was wrong about everything in 2023. So that's going to probably be my next episode. As always, please feel free to leave me some questions, comments, drop them below, reach out to me anytime, and we'll see you guys soon. Bye.